All right, I want to turn now to the crisis inside Victoria's hospital system. As of December last year, at least 80,000 Victorians, 80,000, were on waiting lists for elective surgery. Now there are fears there are thousands more have joined the queue. The Andrews government is refusing to release the updated numbers. Today, the Premier's deputy, James Merlino, the bloke that was warned about the looming ambulance crisis a couple of years back but did nothing, he announced $1.5 billion of taxpayers' money to clear the backlog, including a public takeover of a private hospital in Frankston. For her reaction, let's bring in the Shadow Health Minister, former nurse herself, Victorian Liberal MP Georgie Crozier, who joins me now from Melbourne. Well, we've heard this before. 2 years ago, the Premier said $1.3 billion, Georgie Crozier, would be there for 4,000 ICU beds. The beds never happened. We don't know where the money went. Are we confident these surgeries will actually happen?
Peter, I just don't think this government can manage this crisis at all. Let's not forget that this health crisis has been not just because of COVID, it's been years in the making because of the mismanagement that's been going on under Labor. We've had $100 million in March of 2020 to deal with the elective surgery backlog, another $300 million a few months later, the $1.3 billion that you spoke of, $200 million back after the flu in 2019. This is just another announcement, a funding announcement that is joining that long list of funding announcements, and the government has no answers in getting this situation under control. Daniel Andrews can't fix this crisis that he's created.
We've also got the ambulance crisis in Victoria. It's interesting, in South Australia, in the election campaign, there was messages written all over the ambulances criticising the Marshall government. There had been 2 deaths in recent months claimed because of ambulance failures. In Victoria, there's been 12 deaths in 6 months, again blamed on ambulance failures. Yet I can't see, as I drive around, ambulances full of political slogans, angry at the Andrews government. We've got another report today about ramping in Victoria. That was in the Age newspaper. We're told that last Thursday night, ramping was so bad, as many as 9 hospitals were ramped, and an extraordinary number of 22 crews were ramped at one hospital alone. 22 ambulances. That's the Monash Medical Centre. This is a disaster too, Georgie.
Oh, totally, Peter. I mean, you mentioned the 81,000 Victorians on those wait lists at the end of December. You know, many of those people are getting sicker. They've had delayed health care, they're getting sicker, they're needing that urgent care, and they're often in the back of these ambulances. I mean, the AMA, as Sarah Whitehead said yesterday, or Saturday over the weekend, that people were dying in the back of ambulances waiting and in EDs because they're not getting the care that they deserve and need. This is an absolute disaster, Peter. And we don't know, the government will not tell us how many Victorians are on this elective surgery wait list. So not only do you have this crisis amongst in the ambulance sector with so many ambulances ramping and people stuck in the back of the ambulances not being able to get into the EDs to be seen and to be treated, you've got all these other Victorians who've got no understanding. Their GPs, their specialists cannot tell them where or when they'll get their surgery. It is an absolute disaster, and I'm terribly concerned for so many Victorians who are just desperate to know how the government's going to fix this crisis.